Good afternoon. My name is Dr. Sonia Shenoy. I work as an associate professor in the Department of Psychiatry at Kasturba Medical College, Manipal. Today we'll talk about postpartum depression. Postpartum depression is a mood disorder which affects women immediately after childbirth or up to a period of 1 year after childbirth. Around 22% of Indian women experience postpartum depression. What is more commonly experienced is a concept called postpartum blues or maternity blues or baby blues. This is seen in up to 80% of new mothers who experience these symptoms. They feel overwhelmed, they feel like crying easily, they feel more tired, and they find it difficult sometimes to manage their new role. This usually happens a few days after delivery and lasts for a couple of weeks, and it usually resolves on its own within the first month. However, around 22% of people go on to develop postpartum depression. So the cause for postpartum depression is not a single cause. Usually after childbirth, there's a lot of variation in the hormones, estrogen, progesterone, where there's a rapid fluctuation in the levels. To add to this, the whole difficulties of childbirth, chronic sleep deprivation, new roles and new responsibilities, and sometimes inadequate support can make it overwhelming for the mothers to take care of their babies, especially in the first pregnancies. However, there are quite a few risk factors which can add to the risk and make a person vulnerable to develop postpartum depression. The risk factors are past history of depression or bipolar disorder in the patient herself, or family history of depression, bipolar disorder, or any psychiatric illness, including postpartum depression in a family member, can make a person more vulnerable. Even significant life events like loss of job or domestic violence, getting a new illness during pregnancy can make a person vulnerable. Similarly, medical comorbidities or medical complications in the child, like maybe difficult labor or medical illness in newborn, can make it difficult for the mother. Some more risk factors are being unprepared for the pregnancy or not being sure, especially if it was an unplanned pregnancy, or if the gender of the baby is undesired, as oftenly is seen in India. Some other risk factors are poor social support and poor emotional support from spouse, family, or friends. So combination of these factors and other difficulties can make a woman vulnerable to develop postpartum depression. The symptoms of postpartum depression are varied. It's a lot like depression occurring in any other phase of life. So the common symptoms are feeling very sad almost throughout the day, or looking dull, feeling disinterested in activities. That could be daily activities or activities which they once enjoyed, like reading or watching TV. Feeling fatigue. Though fatigue can be seen post-delivery, this fatigue seems overwhelming and it seems difficult for them to do their daily activities. Negative thoughts leading to one's own ability to manage the child, negative abilities about one's own efficiency as a mother, preoccupation and worry about the child, and guilt related to one's inability to perform the role. Suicidal thoughts or ideas to harm oneself, either sleeping too much or not getting any sleep at all even when the child is sleeping, finding it difficult to do one's own self-care and needing prompting for it, feeling low on appetite, not eating at all or eating excessively to cope. So there are a whole lot of symptoms, including difficulty in concentrating and taking decisions. All this can cause problems with bonding with the child or taking care of the child adequately. So these symptoms, when they start interfering with the daily routine or when they start causing significant distress, it usually leads into depression. It could be mild, moderate or severe. That depends on the number of symptoms and the severity with which their daily functioning is affected. So depression, when present, we also need to check for psychotic symptoms like delusions, hallucinations, which are false beliefs or hearing things which are not real. So these things need extra care and ideally need assessment by mental health professional immediately, because there is a small risk of harm to self, and very rarely when there are hallucinations related to the baby, it can be slightly risky to the child also, but the risk is very minimal. So these are the symptoms of postpartum depression. Usually family members do not encourage seeking for help. One, because of the logistics, it's very difficult for a new mother to travel with the baby or leaving the baby at home. Second, self-care and mental health of mothers are usually not given as much priority, because taking care of the baby is supposed to be the topmost priority. But one thing which people don't realize is taking care of mother's self-care and health is very important, not just for the mother but also for the family and for the development of child. The child's mental development and social and cognitive development happens in the first year after childbirth. Significant proportion of it is dependent on the mother's ability to take care of the child and to respond and soothe the child. And this is also important for the child to develop emotion regulation and to develop healthy adult relationships later in life. So it's very important to be aware of the symptoms and to seek help when needed. Treatment options are multiple. It could be medication, it could be therapy, or it could be both. For most of the patients, therapy and counseling is enough, where we teach the mothers to be aware of their negative thoughts and behaviors and to modify it accordingly. Interventions to relax and to feel better and to cope better with stress, mindfulness techniques, and ways in which they can enhance the relationship with the baby. Bonding, attachment related practices can be taught. And medication is usually something which is given only when it is needed. And sometimes it's more beneficial to give medication than let the mother suffer, especially in moderate severe depression. Most of the medications are usually discussed, and the ones which are safe and which have very minimal impact on the baby is suggested. So a thorough evaluation of benefit and risk ratio is discussed with the patient and the family, and only then, when the mother is comfortable, the decision to take medication is taken. A regular follow-up is also needed, and also breastfeeding related precautions are usually discussed with the mother. So hopefully, with being more aware of this illness, many women who are silently suffering with this disorder try to seek help and get better, and indirectly help the whole family and as well as the child's future. Thank you.